pause in breathing for about 10 seconds. That's what the sleep apnea is defined as, really. It's an obstruction in the airflow to the lungs, and hence the oxygen supply to the brain. So there's a pause in breathing for a few seconds. But this could be happening for lots of episodes of sleep apnea. It could be happening during the nights, during the child's sleep here. So if it's happening a lot of times, that's a lot of oxygen deprivation to the brain. And we know that the brain cells, they die off. That's true, and people think sleep apnea only happens to big fat people. That's not true. It's there in children, and I'm sure you talk to some of the teachers in schools, and they'll be able to tell you there's children that they're not doing so well, not able to pay attention, maybe disruptive in the classes. And when you look at those children, you often just see that they're mouth-breathing children. They have retronatic faces. Ask a few more questions. Those mums will tell you those kids are all moving all around the bed. They're tired in the morning, or else they're running around with too much energy, and they're tired later on, and they're not able to pay attention, and they don't do well in school. Teeth grinding, the mouth open at night, the recurrent infections, chesty coughs. You may notice your child's bedwetting, or they might be waking up with nightmares quite regularly. That's another indication, because that's when the brain is really getting disturbed because of the lack of oxygen. And maybe they're not doing so well in school, or they're not able to pay attention. But sleep apnea is a big problem today, and it can be happening in your child, and you may not know that. It's not a normal thing to be happening, really. If patients are having disturbed sleep, or snoring is an indicator that airflow may not be efficient to the lungs, and hence the oxygen supply again to the brain. If the oxygen supply isn't efficient, then of course brain cells are going to be affected here. And this has been shown in the MRI scans now, that their areas in the brain are actually obliterated, and especially memory cells. Modern research now is telling us a little bit more that these children with ADHD, in fact, it may be not really a disease, but just more of a symptom of breathing disorders at nighttime. And their behavior has changed. And of course, they're being labeled as possibly on a spectrum, when in fact it might only be actually a sleep disorder they have. If their airways were developed at a younger age, they may not have any problems. And we are seeing that as well. No, because when there isn't efficient oxygen supply to the brain is a very greedy organ. It needs it. So initially it's going to instruct the cerebellum area to start, let's get the heart rate going up, and the blood pressure will rise, and the adrenal glands will start producing more adrenaline. We're starting to get more sugar supply. The diabetes is another factor that's going to be playing into any disturbance in breathing at nighttime. So chronic illnesses then, irritable bowel, Crohn's disease, other things have been mentioned. We still can't prove everything here, but certainly all these patients that tend to have sleep apnea are more prone to stroke, for instance. Snoring, we know, creates plaque buildup in the carotid artery, and these plaque buildups, as you know, can easily just fly off and cause someone to have a stroke. When we see children with their mouth open, the problem with mouth open is that we're not getting the tongue up into the roof of the mouth to guide the face to grow forwards. So what happens then is the structure is growing in a negative way. The lower jaw is beginning to fall down and grow backwards. We got to realize we have to have enough room in our mouth for all the teeth that we are designed to have, which is 32 teeth later on. We also need room for our tongue, and as soon as the face is growing downwards and backwards, the tongue doesn't have enough room in there later on, so it's sitting further back in the airway. And as soon as it starts to sit further back in the airway, it has a negative effect in airflow through into the lungs. And the child may find that they're struggling for air at night, they may move around the bed at night, they possibly could have sleep apnea if the tongue is obstructing airflow at all, even for a few seconds. Our brain needs oxygen all the time. If it's not getting it, there's going to be problems.
So if we have a tube, a breathing tube here in the throat, this is the collapsible part of the airway. Now it's slightly supported at the back, but the whole front of it is collapsible. And if you're not working those muscles, and there are many muscles that I'm talking about in this whole area between the chin, this hyoid bone, and right down to the clavicle or the collarbone and the breastbone or the sternum, if you're not working those muscles, and they're all the ones we work in myofunctional therapy, you're going to end up with flaccid or flabby muscles. And that's where you have your apneas.
The super important thing about treating children early enough is that you can guide the face to grow forward, get the jaws further forward, improve the size of the airway. And as soon as the airway is bigger, they're breathing better, they're sleeping better, they're standing better, they're looking better.